in Latin America, in my country, Mexico, we have this problem, and it's exactly copy-paste in all over the world, I have to say. It's only about education, as Mandela said. Education, 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 education. This is the key point for us. When you provide the information and good education to your kids, they will not have these problems when they grow up. This is a fact. So in Mexico, and I'm going to Ecuador, I told you, next month, and Panama, Argentina, all Latin America, we have the same problem that Africa. And if you go to Europe, you will find also this problem, that people keep quiet, because really they don't want. Sometimes they say it's a shame, sometimes they say, well, you know, it's not a big issue, and they just suffering all their lives. And traveling all over the world, I find out something very, very, very important for me. We have machos all over the world. It's not only in Mexico. I grew up thinking that macho is only in Mexico. Macho Mexicano. No. We have machos in Australia, New Zealand.
Please explain machos.
Macho is like masculine, very brave, you know, this, you know, macho man. Everywhere. Switzerland, Russia, well, of course, Lebanon. So it's this kind of behavior that is part of our genes, I think so. So it's something that in my office, when a couple came and we want to find out why we are pregnant, we said, good, so we will start with you. And they go, what? Yeah, they don't want it, of course. Because I will spend so much time review and having tests with my patient when it's only one test for me. One. So what? Very cheap. So this is the point for me that we have to have a better education. We have, as NGOs, in many countries, we have a free time in the media as a duty when they start a channel, a TV channel or radio channel, but they didn't promote it. So look for this free time for NGOs and universities in your local media or national media, so you can promote campaigns to avoid this kind of problem. They will never tell you that they can give it to you free time in the media. So this is, and I hope so that we can do a very good campaign for Latin America and other countries. And as a doctor, it's very weird, very weird that we can find a pharmaceutical that are really fully involved in a program supporting the people. It's very weird. They invite us as a doctors to the conference and pay the hotel and blah, 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 because they want our recipes. But doing this campaign to support the communities for nothing, putting a lot of money, really a big applause for them.
Y lo que se está tratando en este país.
And when we are talking with this man.
El gran problema está en que la mujer está estigmatizada.
The biggest problem is that we have a stigma in the women.
Y muchas de las enfermas no buscan los servicios
And a
especializados.
lot of patients look for the medical services.
Van buscando hechiceros,
They first look for magic solutions,
lo que resulta en el agravamiento de la condición de esas
And the result is to increase the severity of the disease.
El gobierno está implementando un proyecto
The government are actually implementing a project.
lo que con el convenio que se puede firmar con Merck
An MOU that we can sign with Merck
a través de la Universidad de Augustine
through the University Agostino Neto,
en particular la Facultad de Medicina donde soy decano,
particularly of the medicine faculty where he is a teacher,
podemos educar a la población,
so we can educate our people,
hombres y mujeres en general,
men and women in general,
para tener una conciencia más humana al respecto de la situación de la fertilidad.
to have a better understanding about the infertility and in the condition of in the human being.
Con estas palabras creo que ya tenemos lo suficiente para decirles
With these words, I think that we have enough to say
de que esperamos con mucho agrado la cooperación con Merck,
that we are hoping and wait for this cooperation with Merck,
en particular con la doctora Rasha Keller,
particularly with Dr. Rasha,
que por segunda vez Angola se hace representar en estos eventos.
because of her, Angola is represented for the second time in this kind of events
En menos de 6 meses
in less than 6 months.
y con esta actitud acredito que vamos a llegar muy
And
lejos.
with this attitude, I'm sure that we will go very far.
Esperamos que ustedes puedan contar con nosotros. Muchas gracias.
Forward that you can come with us.
For having me with this panel. First, a word of correction. South Africa is the first country to have ART regulated. Kenya will be next. Number 3 and 4 is the contested field, because Uganda has got a draft regulation which has been put through the Minister of Health to handle. So we might be choosing it in Nigeria, but that's an open field for examination. Permit me now to turn to embryology. First, I want to address it in 4 principles. One, who is an embryologist? Number 2, what is the status of embryology in Africa today? And if it is what it is, what is Merck and African Fertility Society doing about it? Then finally, what is the future? So let's examine who is an embryologist. In fertility care, the limelight is taken 100% by the specialist gynecologist. He sees the patients all the time, at length of the time. The embryologist sees the patient just maybe or maybe not at all, because his focus is technical, his focus is scientific. He is examining and assessing the gametes, that is the sperm and the egg. He is examining the fertilized egg, the embryo, to make sure that it is of good quality, and from his assessment, he will then inform and support the decision of the specialist in going ahead with recommended treatment. So it is a highly technical skill, and it is more in the lab under the microscope. Now, his output is fundamental to the success of the pregnancy and protection from the baby. And it is therefore a critical input in the human resource requirement of ART. What is the situation in Africa? It is acute, severe, and deep. Take the case of Uganda, with 6 clinics undertaking between 500 and 800 cycles of ARC a year. There are only 2 Ugandan embryologists. That means the ratio of an embryologist per cycle is somewhere between 250 to 400 cycles a year. The recommended ratio is somewhere between 100. So that is the dire situation in most of Africa. It is in recognition of that Merck, who is a leader in innovation and sharing knowledge, picked up this gap and said, in discussion with African Fertility Society, that we must do something about training of the embryologists. And that has started in Indonesia 4 weeks ago, and that course is running for 3 months. But the importance of that training lies in seeing what has worked during that training and what has not worked so well, so that training program is rolled out to the rest of Africa. I think this is the multiplier effect which we want to see come through from the training in Indonesia. And as we talk today, the 2 scientists undergoing training have reported that they have been permitted to undertake research during their training time, just to see how rapidly and how effectively they can undertake and reproduce the skills they are learning there in Indonesia. And I think this augurs very well for the future, for themselves as they go back to their own countries, and also as they help Merck and help African Fertility Society roll this throughout Africa. So there is the future, looking brighter. But I must also emphasize that the training is not for export. It is not for immigration that they go to seek better pastures elsewhere. This is training for Africa, and that is the emphasis of this multiplier effect. Next issue is the relationship, how when they come back to their own country, the level of integration in the services which my Honorable Minister is implementing. That is the preventive aspect. That the curative and preventive aspect will run concurrently with the trained clinical and embryologists. And of course, finally, it is the integration of that training with the policies of Merck, the policies of African Fertility Society at a regional and a global level. So I think that is the essence of it, that together we can cause the cultural shift, we can cause change in clinical practice as well as in the scientific development.
Thank you very, very much.
A woman is playing her role as an active individual in all fields. So we have witnessed some cultures in Africa which actually, unfortunately, discriminating against infertile women. We have witnessed that 1 every 4 couple is infertile, and 85% of this infertility is coming actually from infections, whether from sexually transmitted diseases, whether from female genital mutilation, whether from unsafe abortion or unsafe delivery. Why is this panel happening? This panel is happening because if we're talking about women empowerment, if we're talking about sustainable development goals, it's about access to health care. So this panel is about having access to health care. Sustainable development goals is about education. So here this is about awareness and education for women about why this is happening and about prevention. But it's also about changing the mindset and the negative cultural aspects that we are witnessing in our societies. How whether she has children or she has no children. But it's also about changing the mindset with reference to the couple. It's a shared responsibility. If we're talking about women empowerment, it is very important that she has access to all the tools of her choice, of being a mother or not being a mother. So this panel, you have seen that it is really about having all the power of Africa, from the ministers, the academia, the parliamentarians, the private sector. How can we all work together with reference to empowering her socially, empowering her through access to health care, empowering her so that no one can come and throw her from her home, no one should come and beat her and she witness violence against her. If we're talking about violence and non-discrimination, which is the Convention of elimination of any forms of discrimination against women, we have to say that this is real empowerment. And I am really very happy that this campaign has been led in Africa by my very good friend, Dr. Rasha Kalash, who is the Chief Social Officer of Merck, and also Professor Frank, who is really at the top of the leadership supporting this initiative for women empowerment. So I will give now the floor to Dr. Rasha Kalash.
Thank you so much. I chose for this subject the name of Mother of the Absent, and I think you can understand why would I choose this name. It is addressing the stigma of female infertility in Egypt. I would like to start by talking about infertility since the pharaohs in ancient Egypt. Ancient Egypt. We know how the ancient Egyptians tried to deal with infertility through some of the medical papyrus. The Kabul gynecological papyrus has several, now unhappily mangled, ways to test a woman's fertility, including experiments that involve the subject sitting on the earth, covered in beer, being force-fed dates, and being monitored to see if she vomited. If she somehow managed to keep it all down, she was never going to have any children, anything.
People believe that if they go to the priest or the pastor, fibroid can be healed. People believe if you tell them that, oh, you have very low sperm count, they say, I reject it. I reject it, and in the name of, they will mention whatever God, it will not happen. So what are some of the things that has now happened? With the awareness, men, you see, when you say that 50% of infertility is due to men, it's wrong. I tell my patients, actually, you are either 100% fertile or 0%. And in most cases, when these men have infertility, the wife is normal, but the man does not come to the clinic. So you are busy treating this normal patient, and sometimes these normal patients, they go to doctors who perform surgery on them. And they perform surgery and surgery. And by the time you see these patients coming for in vitro fertilization, the man has 0 sperm. So, in the guidelines now, and I think we will pass the WHO guidelines to most, which is now being circulated to most people in Africa, sperm analysis is the easiest thing to perform in infertility process. So men must accompany their wife to the clinic. It should be a mandatory thing. And we found out that when men follow the wife to the clinic, the success rate for fertility is higher. So, and there are so many other levels of ignorance. And what I can now tell you is that 20 years ago, I could not tell people that my clinic is a fertility clinic. In fact, people could not want others to know that the baby they have was through seeing a doctor. That is how bad it is. But today, people are now coming and saying, yes, my baby was through surrogacy. So there is now acceptance. So we're on the road to improvement for the benefit of mankind, especially for women. So I think, and for others, so I think I'd like to cut the discussion short and leave it at this point.
Come a long way. For us to sit high on this panel and discuss infertility, it is a big step that we have made as African and African leaders. I think we should give ourselves a hand for that. Because before, you wouldn't have such conferences, people sitting down talking about infertility. Like you had even before other speakers, it is a taboo. It's like you're a cursed woman when you don't have a child. Everybody looks down upon you. And to have somebody like me in a leadership platform, to even start talking about my own experience, it's very difficult. But then when you become a leader, you have a choice, either to tell your story or to let other people tell your story. So I chose that level of saying, this is the platform that the people have given me. I have to use this platform in order to create awareness so that other people before me or behind me would not go through the same problem. Part of the video that you haven't seen is I had to adopt my own child because he was born from a surrogate mother. And the law that we had in Kenya, that still is in Kenya, does not recognize surrogacy. So after my baby was born, the surrogate mother was a good friend of mine. So she agreed for me to take the baby from day one. But then legally, that baby was not mine. I mean, after everything that we produced, the agreement from the lawyers to show that the baby is mine because that was my egg and my ex-husband's sperm, but still they could not recognize that because the law that was in place says the woman who gives birth is the mother of the baby. So those who have children under surrogate process, they're not recognized by law. So I decided to take a longer journey because surrogacy is not new in our country. Women go through the same process, or couples go through that process, but then what they do, they go through the back door to get, legal certificates for their children. But then here I am, I've declared interest to become a leader. Nobody has ever seen me pregnant. Then what do? I said, I'll take the long journey. It doesn't matter how long it's going to be. It was in and out of courts and seeing the lawyers and the judges. It took us almost 4 years to now be able now to legally be recognized as the mother of my son. So I went through the normal adoption process. And when I got to Parliament, I said, we have to change this law because we cannot let any couple or any woman to go through this painful journey. And when I got there, another member of Parliament who was there, previous Parliament before me, had a draft on IVF. So what we did, we put our heads together and I championed for that bill. We called upon all the stakeholders, all the doctors and people who are in charge of infertility and IVF clinics in Kenya. And together we came up with a very good bill. And in this bill, it recognizes you as a woman who gets a baby, either through adoption or through surrogacy process, to be identified as a mother of that child. And not just that, also to regulate the IVF process that has been happening in the country, and also to create awareness to tell people that there are other methods that you can use if you cannot conceive naturally. As we've seen in the video, like lack of information, lack of knowledge is something that's really making people suffer, making women suffer. Women are the ones who carry all the embarrassment, they carry the shame, they cry tears at night, and sometimes they're not the ones who are carrying that problem. It is a shared responsibility. I want to thank Merck because through this initiative, it has opened up conversations. It has opened up, talking amongst the men. Men are coming out also to talk about their problems. And one by one, we're seeing them accompanying their spouses to the clinic so that they know that it's not just a woman's problem, but also a man has that problem too. And we're happy because now, just 1 week ago, we passed we changed from IVF pill to assisted reproductive technology, so that now we can cover all the other methods that are available, not just IVF. So already we passed that bill at the National Assembly, and it is the first bill actually in Kenya, maybe in Africa. I'm not sure about other countries. In Africa, it is the first bill in Africa, and right now it has been taken to Senate, and after Senate it will come back to the National Assembly, so that after that the President now can sign it into law. So it is the biggest achievement that we have achieved as women parliamentarians in Kenya, and we're not going to stop there, because if we don't take it down to where the people are, lack of information will still be like a bondage around them. Because sometimes we make good laws, but then implementing those laws becomes an issue. And if they're not implemented, then we're not going to realize the culture shift that we are talking about. Because when we have more information going down to the people, then you find out they start talking about it freely, and they have access to information, access to medical treatment for early prevention, early detection, and also so that the price of it or the cost of it can be affordable. Thank you very much.
Unique initiative. When I was invited to come here, it struck me because I've never had this kind of initiative. My going for conventions and health seminars. First of all, of course, the job of parliamentarian is to introduce laws. And we have this summit, parliamentarians from about 5 different countries in Africa, led by Kenya. Since Kenya is the first African parliament to introduce the ARC bill, and I believe Nigeria will be second. A challenge to my colleagues here today. Thank you very much. The parliamentarian attracts a lot of publicity whenever he or she is introducing a bill. And I believe introducing this ART bill will definitely attract the publicity that this initiative needs. And I'm already trying to prepare how to introduce this bill in Nigeria. Nigeria is a very peculiar country. First of all, we have a population of close to 180 million people. And we have like 50% Christians, 50% Muslims. And the first point of call of any infertile patient, in most cases, is always the church or maybe the mosque. They approach the Reverend Father or the priest because they believe that the problem of infertility is more spiritual than physical. So our first group of people to educate on infertility will be the priests and also the imams in the mosque, because they are the ones to first of all tell patients that they are just messengers of God, to tell the patients that God created the doctors, and God gave the doctors the wisdom and the knowledge to be able to go into their system to know where the problem is physically. So, which is a major agenda in this program, to have a culture shift. Also, the parliamentarians in the country, they have a very big role to play, because we are the ones that campaign all over the country, asking for their votes, and we also have a very good opportunity to educate them. So I intend to educate my colleagues as an ambassador to be of this program, to ensure that in all our campaigns around the country, whenever we campaign, having our town hall meetings, we also have at least 2 or 3 sentences to say about the culture shift, and also to propagate a more than a mother. I believe this education is coming at the best time, because in Nigeria today, when you go to one of the churches, because Nigeria has the largest churches in Africa. We have some churches that is populated by about maybe 2 million people in one service. It's in the Guinness Book of Records that we have the biggest churches. So, during those services, the pastor will ask for couples that are looking for the fruit of the womb. They should come forward. And because different types of problems, people that have problems with their visas, people that have problems with the school fees of their children. But in all these calls, it's the largest people that come out, number of people that come out are people with a problem with the fruit of the womb, which shows that it's a big problem in Nigeria. And in the peculiar situation here is like we have been saying since that it's only the woman that comes up, the man doesn't come up when this problem arises. But in the churches, we see the couples coming out together whenever they are called for this problem for prayers. So that is also an area where we are going to emphasize that it's the husband and the wife that should seek treatment for this infertility. In closing, assuring Merck that I will do everything in my power to ensure that we make the loudest noise in Africa for more than a mother campaign. Thank you very much.
The short video just watched, there are a lot more graces out there. In Africa, everything is a taboo. But as we approach the 21st century, we are talking more about some of those cultural practices. We can discuss about FGM, now we're talking about infertility. The questions that she asked me to talk about is the role of culture, especially our mothers. When a child is born, we celebrate. The child goes on to school, we celebrate. The child gets married, we celebrate. After that celebration of the marriage, the mothers are waiting for their grandkids. The pressure starts on the family. The pressure comes from the mothers, us. It is not time that we change our minds and change our attitudes as we look at cultural norms and traditions. Culture and traditions can be modified. They can be changed. a woman's right, like Hillary Clinton said, it's a human rights issue. Most time, as mothers, we try to please our men, our male counterparts. In our society, when FGM is performed, it's done by women. It's not by the men. In our society, when the daughter reaches puberty, the mom is waiting to see when she's going to get married. We need to change the way we do things. We need to change our minds. We need to change our attitudes. We need to treat our daughters equally as we treat our sons. You send the daughter to go fetch water while the son is playing football. Because in my country, you want him to be the next George Weah. But now it's changing. Everybody wants their daughter to be the next Ellen Johnson Sirleaf. Never a time in the history of Africa anybody thought a woman would have been president because of our own culture and tradition. If we have to improve human rights, if we have to improve the rights of women, if we have to give our girl child the opportunity to go to school as equal as the boy child, we have to change our mindset. We have to change the way we think about tradition and culture norms. Traditions are fine, don't get me wrong, I love my culture, but they can be modified. Those bad practices that has to do with human rights, women's rights, those parts can be modified. Infertility, like she said, is not just from the woman's side. Let me tell you a story. My cousin and I got married at the same time. Both our parents were waiting for grandkids. I had 2, and my cousin had none after 5 years of marriage. The husband's parents got impatient, and they both separated and went their different ways. Right after separation, my cousin got married to another guy and had twins. And the husband she divorced up to today has none. So it's not always the fault of the woman, but in our culture we always think it's the woman's fault. It's not time for us to speak out. Both men and women can be affected by infertility. But we need to change our mindset. We need to change our minds. We need to change our attitude on how we address the issue of women's rights and how we link it to human rights. Culture is good, but I want to leave with this message that culture can be modified. So the life of Grace and the life of many other women out there and men can know that it's not their fault. It can be corrected. It can be fixed if we all give them the kind of support instead of blaming them. We want to be grateful to right that started in a few African countries. We hope that this campaign can be extended to other African countries so that the message, the awareness can grow. You have the issue of fistula. You have the issue of FGM or cutting, early marriage, teenage pregnancy. Let us add infertility to that list. And let us continue the campaign from a regional level, sub-regional level, to a continent level. I'm glad to see all of the parliamentarians here, the academians, the executive civil society. It has to be done together. Thanks to the organizers, thanks to Merck, thanks to all for the invitation.
I can't give you any sort of final answer to that because there are so many very knowledgeable and empowered women around me, and I really mean it. Because this problem is not only an African problem, you have to be aware of it. The same problem happens in Germany, in our own families. And the moment a woman is not doing what God has given her to give birth to children, she's stigmatized. Never the man, always a woman, and that's awful. Yeah. That's the first thing. Second thing is, even in Germany, where we say we are a relatively advanced country, this stigmatization is there. So it's not only in Africa. It's probably much worse here because you are living in far more traditional societies still. Yeah. So what can we do? See, when we designed our Africa strategy at Merck in 2012, we started. So we said, look, we really have to go to Africa. We have been here before, of course, in Northern Africa, we have been in Southern Africa, but in West and East Africa we haven't been. So we said we have to go there. Of course, we are a commercial company, that's not a secret, but on the other hand, because we've got the financial means, we can do a lot of things. So it's one stone after the other. It was a capacity advancement program, and of course, and now Merck more than a mother program, and many more will follow. It's about cancer, it's about diabetes, it's about infertility. And to do this, we have to work, what I said before, closely together with the governments. Yeah? But at the end of it, all we can do is teach, to give advice to women, to teach, to try to overcome culture. And I tell you what, to change culture is a harder thing to do. It takes a lot of effort from all. It has to come from top down, but it has to come from the bottom as well. And if you see this really very hard-moving testimonies of all levels, also yours, it's something we really have to tackle in a very positive way, but we have to work on it, and we have to be aware of the fact that that will not be over in half a year's time or a year's time. It's something we have to work on probably a decade, if not even a generation. The best way to do is by giving example, by giving testimony, by governments to help. And I remember one discussion I had some 1.5 years ago with a German minister, she was a junior minister, but still minister, about exactly this problem, of the refunding of treatment of infertility in Germany. And she said to me, oh, infertility is not an illness, why should we refund it? But you see, even in those levels, there's no acknowledgement of it. So, it's hard work, it's an uphill struggle. I think it's a very worthwhile cause to take on. As I said many times before, we need the help of the governments, we need the help of NGOs, we need the help of women to come forward and speak up and to try to change it. Can't say anything else to it. It's not easy, but we will succeed in every day. Absolutely convinced.
To Russia, colleagues, panelists, ladies and gentlemen, first and foremost, I want to thank Mark for picking on a subject that is known by everybody, but is not talked about. So I want to thank Mark for breaking the silence on infertility. Because we all know that oftentimes in our own settings, in our own homes, when a woman fails to give birth, then she's the one who is blamed and not the man. So this campaign is going to help us to bring out the facts and say that infertility is a shared responsibility between the men and the women. In my country, in Uganda, between 10 to 15% of the couples that want to have a child annually fail to have children. So infertility is a problem that we all recognize, and of course, as said by Dr. Rashad, it can actually be prevented. So what we are doing as a country, or what we have done since we had this campaign launched in February this year, is first and foremost to recognize the problem, but most importantly use the existing structures to actually provide services and information. In Uganda, we have structures, health centers, up to the health center 2, that is the lowest administrative unit, that is at parish level. So we have reproductive health services that are provided free of charge at most of these health facilities. So what we as a country are doing is to ensure that now, moving forward from the time of the campaign, We first and foremost provide information to the health workers, and also we expect the health workers to pass on this information to the mothers as they go to the health facilities. We have been looking at productive health and prioritizing issues of contraceptives and talking about family planning. But we now intend to have this campaign against infertility as one of the priorities on reproductive health services. So, ladies and gentlemen, of course, Uganda also, we have had challenges regarding services to the mothers or the women and men who are infertile. Most of the services are provided, actually 5 clinics that provide, or hospitals that provide this service are in the capital city. So you find the countryside, the women in the rural areas cannot access this service. So this is a challenge, but a challenge that we all hope that we are going to address, especially if we focus on the prevention, and then the few that have challenges can then be attended to at government health facilities. We are actually happy and we want to thank Merck because they have offered to train some 5 enrollees, are quite expensive, and if you don't have $1,000 and above, you may not be able to get the services. So regarding what we hope to achieve, or our objectives, first and foremost, as said, is to raise awareness, but most importantly, to provide services to those women out there and men who cannot be able to afford the private health facilities. And of course, we hope that with this awareness that we are going to raise, we shall be able to also reduce the stigma. Because most of the people who have challenges with infertility have been keeping the problem to themselves. It's between them and their closest families, and they don't speak up. But also, most importantly, we hope that with this campaign, the men will also take responsibility and be able to seek for treatment at the selected facilities. As a government, of course, we are privileged that currently the government of Uganda is putting up a 320-bed women's hospital. So this will help us to focus more on matters regarding maternal health matters, and of course this will be one of the key services that will be provided at this government facility, and we hope that we shall press that it be free of charge, because this is going to be at the national level. So, ladies and gentlemen, of course the women that do not give birth are often looked at as women who are of no value, they are stigmatized, and this we hope we can end. Every woman must be looked at as a woman, irrespective of whether she has given birth or not. You don't have to know me as a mother of so and so. Just like the men are looked at as men, and nobody asks whether they have given birth or not. The same should happen to women. We should all be equal as women, and of course from there we can then be able to move forward and talk about equality between women and men.
Thank you very much, Rasha. Now to acknowledge Merck and the role they played to get us here. It's incredible really to be part of such an audience and to join honorable members, academics, and the senior representative from Merck, and my fellow colleagues, MPs. I think what we were discussing in Russia is the problems are not unique from what has been stated here this afternoon. We have the similar problem because of underdevelopment and poverty to a great extent. I think levels of unemployment as well contribute significantly to that. I think what is important, we have a constitution that was adopted in 1996. Reproductive rights is enshrined in the constitution because of where we come from during the era of apartheid. African women in particular were not allowed to have abortion. Whatever abortion they did was illegal, and many of them today cannot bear children simply because of that era. So that's why today the constitution has a clause that talks to the reproductive rights. And I think similarly to what is happening in Uganda, we've got clinics that women can access primary health care, and particularly the reproductive health services. We have a center, which is, we call it our Center of Excellence, in one of the public hospitals. We provide health services relating to IVF, relating to sperm cleaning and sperm washing and all of that. And I think we've seen a couple of thousands of couples who've come through the program as couples because they're HIV positive, who have been assisted through that. And I think we talk about 6,300 or so who come through the program. About 695 of them have been helped because some today they have children and they are really happy. So we believe that the work that we are doing in one public hospital, because of the cost, it is transforming people's lives, and want to extend those services to the rest of the population. And why are we doing that? And I think it's been also emphasized that, and I believe that there is an author who writes about economics who talks about empowering women to be able to do things by themselves. And I think the issues of education is very important. And how do we want to see Merck working with us going forward? The Center of Excellence we have, it's very important. We've got doctors, nurses who are trained, as I said, the number of people that's assisting, it's a lot. But we'd like to see more education be given to the other health facilities in the public sector because the costs are too high. Currently we spend between 6,000 and 12,000 rand for IVF, and we can convert that to dollars and to euros to see how much it costs. Yet in the private sector the costs are too high. So we'd like to get training for our medical doctors as well as our nurses in order to give the services to more many of our patients in the public sector. And lastly, probably Merck will be aware that there is work Merck is doing in one of our central hospitals, the second one. It is precisely in giving equipment to support the diabetic patients in that hospital. Again, the majority of those are women in the same hospital. We've invested money in equipment of really of assisting women who've got fibroids. We cannot give birth, and the number of women who've got fibroids is at the increasing rate in South Africa. So they live a compromised life. They cannot work because at any given point in time they're menstruating and all of that. So that what we are doing with this new equipment that we've got has seen number of women quality of life being improved for the better, and we're hoping to invest more in dealing with that. So I think we can work together with Merck in the number of equipment that we're investing into, but also in the education of our employees who are doctors and nurses. And lastly, just to really spread the message around the educating women to take responsibility and to be empowered. And I think the videos we've seen are phenomenal, and like to have access to those so that we can share it with other women. Thank you very much.
Thank you very much. I think from the two video, we draw two clear lessons. One, that there is need for a legal framework within which to support different scientific initiatives around assisted reproduction. When you hear what Joyce went through in that video, as parliamentarians, I think we must applaud her for the stand she took to go through presenting the bill and passing it at the level of parliament now waiting presidential assent. I think, thank you very much and congratulations, Joyce. To that effect, I think as members of parliament, our role is to ensure that we make laws that will ensure that the private sector and government can engage in research and all the essence around fertility treatment and assisted reproduction. Issues around surrogate mothers, even issues around adoption is still a contestation in many African countries. So this is something which, as parliamentarians, is very important. The second aspect where we need to look at is budget allocation. These are sometimes very expensive venture for government, and if as parliamentarians we don't bring it in the forefront of the public health agenda within the parliament,
it becomes very difficult. So as women in parliament, we do understand, we do know what women like the lady who was in the video from Kenya was talking about, how she was forced around, she grew old, she wants to go back to her where she was born at her home. Even the family members are chasing her away, that you no longer belong here. Those are two prone approach. As parliamentarians, we can make laws on removing those cultural barriers that subjugate women. Secondly, to put budget so that local women, even from the villages, the rural areas, can access fertility treatment through ensuring that Ministry of Health establish treatment centers and clinics in the rural hospitals and rural health centers where women like the one we have seen can access those treatments. We need to give information because all the women, we come from constituencies. We are voted by the electorate. If we can let them know the information through education, through information, through pushing the campaign not at the city, but the campaign at the constituency level, so that women know the options available, women know where they can access the treatment, and women know how they can access that treatment. It's very important, and also ensuring that we appropriate money for training of health workers, the nurses that are manning these centers, the treatment centers. It is our role to ensure we put money in our different budget in our country to build the capacity of the nurses, the capacity of the doctors, because sometimes infertility doesn't present at the highest level where Merck is training embryologists. But there are those that are simple lack of ovulation, which requires simple treatment, maybe at the lower hospital. Some of those treatment of STIs, those are areas that we can support our government, bring the campaign in the forefront, put money and build the capacity of the nurses and the doctors to ensure that they can make necessary intervention to prevent infection and to ensure that they give relevant information to the patient. Thank you.
More than a mother is a very interesting topic for me as a medical doctor, because I have first hand information on what motherhood means to a woman and the family. Every woman expects to be a mother one day, but due to several factors, as we have seen some of them in the video, some women are not able to conceive and deliver a baby. The inability I wanted to close it. Is this close enough? Yes. Thank you. The inability of a woman to become pregnant is a recipe for shame, ridicule, stigma, discrimination, and ostracization. The consequences are denial, access to family traditions and property, divorce, physical and psychological violence. Women who are unable to conceive go to every length to own a baby, including looking for fertility treatment, medication, or even stealing a baby. In most cases, the culprit is the husband who acquired sexually transmitted infection without telling their wife, got partial treatment, their reproductive system got blocked, and they are not able to impregnate the wife. However, all the blame is heaped on the wife. At times, hyenas or men are hired to have sexual intercourse with her without her consent in order to impregnate her. According to the WHO, 1 in every 4 couples in developing countries suffer from primary or secondary infertility. In Africa, infertility is estimated at 85% compared to 33% globally due to infections. The social stigma of childlessness is very high in countries like mine, Malawi, and leads to isolation and stigmatization. Men contribute to more than half of the infertility, yet women are considered a failure. Chairperson, I call upon all African women and men to remember that it takes two to tango. Let us change our mindset and ensure that the couple goes to fertility test before conclusions are made. The empowerment of women economically, socially, politically, morally and culturally to challenge certain norms is a means to remove stigma and discrimination. For example, in Malawi, women who are escorted by their partners to antenatal clinics are attended to first. If they dodge the clinic, chiefs charge the man using bylaws. Women are mostly in the forefront, ridiculing their own fellow women, who is infertile, especially sister-in-laws. The practice must stop immediately. Let us support one another. Legal instruments which allow the woman and her partner to go for a smooth test-tube fertilization and implant at the right time, or surrogate pregnancy and delivery with a clear ownership of the child would be the most ideal. If the Kenyan example is to go by, most of the women would be happy, but lack of economic empowerment and would be the hindrance. It is high time women should not hire men for childbearing, not even to be dependent on men for everything. Education of girls, girl child, and economic empowerment of women are very critical. The topic fits very well into today's business. Let the African woman be self-reliant because they are already resilient to a lot of pressures. Finally, Chairperson, through you, Malawi is therefore inviting Merck to launch the program in Malawi this coming October during the World Rural Women's and Mother's Day commemoration. We are ready for the launch. Thank you very much.
E nunca ao homem como se que seja admitido ser infértil.
Masculinity of men didn't allow them to recognize that they have infertility problems.
Esta causa a infertilidade, causa muitas vezes divórcios.
The infertility is cause of divorce,
situações de poligamia e morte.
and death.
Esta situação estigmatiza a mulher,
Is a stigma in women,
causando sofrimento psíquico,
suffering for psychological problems,
isolamento social,
reject from the society,
frustração e desespero.
frustration and
Quero louvar a iniciativa desta campanha e parabenizar a organização.
I want to express my support to this campaign and this organization.
E dizer que nós, em Moçambique, eu estou aqui pela primeira vez, quero agradecer o facto de ser convidada.
And it's her first time here, and she wants to express her gratitude for the invitation.
É preciso, sim, que sejam convocados parlamentares, governos, associações, para que, a uníssono, levantemos as mãos para a luta da estigmatização da mulher.
And I request that the governments, the parliament, and all the associations stand up and raise our hands to finish with the stigma for women.
O que é que devemos fazer?
But we have to do.
Dotar a mulher de informação
Give it enough information to women
para que ela se possa defender,
so he can have elements to fight.
porque no nosso continente a informação é grande déficit.
Because in our continent, information is a huge deficit.
Tendo em conta o índice alto de analfabetismo,
Having a very high percent of literacy,
precisamos de traduzir a informação nas línguas locais,
we need to translate the information in local languages.
uso do teatro,
In theaters,
a banda desenhada, figuras.
okay.
E esta informação deve ser expandida para as zonas rurais
This information has to be in the rural areas
e não apenas nas zonas
and not
urbanas.
only the urban areas.
A outra questão que devemos introduzir nos
Another
currículos
question is
escolares
that we have to introduce in the curricula in the schools
nas disciplinas de língua e biologia,
the disciplines of biology and languages,
para que rapazes e raparigas
so the kids
aprendam desde
learn
pequeno
since,
que o problema da infertilidade é de ambos os sexos.
since early age about the infertility problems.
Também devemos treinar ativistas
We have also training activists
que possam trabalhar junto das comunidades a tempo inteiro.
that can work in the communities full time.
Fazer maior uso dos parlamentares
Use more the parliamentarians
quando vão para o seu trabalho político nos constituintes
when they went to do political campaigns,
e falem também da problemática do estigma em relação à infertilidade.
that they talk about the stigma, the infertility
Muito obrigada e desculpa mais uma vez.
All infertility are due to a male infection, male factor. So, I mean, our male infertility awareness is very important. So, men has to acknowledge and discuss openly their infertility. Shared responsibility is a key team approach for family building. Then education and training. We all know in Africa the lack of trained and skilled professional and embryologists, which is a very important technical requirement for fertility treatment, is lacking. So we are also supporting education and training for embryologists, and we send our first 2 embryologists to Indonesia for 3 months training, one from Kenya, one from Uganda, and the rest will follow after the success of the first stage. And then, of course, defining ART policies. So we will speak today with Honorable Joyce Day, and she will tell us about the first approved ART policy by the National Assembly, which is a great achievement and should be replicated in all African countries. The 4th pillar is building advocacy and open dialogue with government, with policymakers, with academia, with healthcare providers, with media, with stakeholders, different relevant stakeholders that we are doing today. So the social media and the media will post all what we are doing so to build really advocacy for the cause. And then empowering infertile women, empowering them, so improving access to information, awareness and education, and change of mindset, and empowering the infertile women who cannot have children anymore because of any untreated causes, to have their independent life by giving them a small investment to establish their small businesses so they can build their own independent and happy life. So this, I think, is a full-fledged campaign, will actually target all the multi-factor of fertility in Africa. During our discussion, we will address a question to each high-level panelist from each country to give us an idea about the causes and the challenges of infertility in their countries, and how can they find the partnership with Merck and Mother will achieve this objective. And I will address my first question to Minister Honorable Sarah Obindi, Minister of Health of Uganda, and the Ambassador of Merck and Mother in Uganda.
Je suis très honorée pour la parole dans cette assemblée pour partager avec vous l'expérience de la Côte d'Ivoire en matière de prise en charge et de soins. On n'entend pas ça, bien sûr. Je disais que je suis très honorée de prendre la parole devant cette auguste assemblée pour partager l'expérience de la Côte d'Ivoire en matière de prise en charge médicale, sociale des femmes en situation d'infertilité et de stérilité. Pour ce qui touche la fertilité en Côte d'Ivoire, les statistiques existent. En raison de la gêne du caractère secret et confidentiel, les femmes ont divulgué leur maladie, le caractère stigmatisé. Si bien que les prises en charge sont possibles à travers d'autres maladies, c'est-à-dire les maladies qui suivent les violences liées au genre, les maladies qui proviennent après l'excision, les maladies qui proviennent aussi après le mariage précoce. Beaucoup de jeunes filles autour de l'âge de 10 à 15 ans tombent enceintes et on peut imaginer les conséquences. C'est à travers ces statistiques-là, et surtout les statistiques sur l'excision, qu'il y a une prise en charge sociale et médicale de la population. Selon l'enquête démographique de la santé, 38% des femmes âgées de 15 à 45 ans ont été excisées. Par ailleurs, 38% des femmes en Côte d'Ivoire ont subi des actes de violence physique et sexuelle. Les violences perpétrées par les partenaires intimes constituent une atteinte aux droits les plus fondamentaux des femmes et une menace pour leur santé physique, mentale et une entrave à
micro, s'il vous plaît.
500 prestataires de santé ont bénéficié de renforcement des capacités pour assurer les soins de qualité.
Le micro, s'il vous plaît.
La coordination nationale de lutte contre les VBG regroupant tous les acteurs, les structures étatiques, les organisations de la société civile, les ONG internationales, les partenaires de développement, ont permis la mise en place de 43 plateformes de lutte à travers le pays tout entier. 1700 acteurs de plateformes formés et ces mécanismes de coordination au niveau local avec les acteurs s'occupent de la prévention et la prise en charge. Elles sont le centre de la prise en charge. Ce sont des centres multisectoriels de gestion des cas individuels de cas au niveau local. 14 autres bureaux d'écoute des victimes des violences sexuelles. Le projet Assistance et réinsertion sociale des femmes victimes de violences en situation de conflit en Côte d'Ivoire, qui est une composante du projet d'appui institutionnel multisectoriel de la sortie de crise, a financé par la Banque mondiale et par la Banque africaine de développement et piloté par le cabinet du Premier ministre, ont donné un appui certain et ont renforcé les capacités de 150 policiers, gendarmes et agents de justice, 158 prestataires de santé, 200 acteurs de prise en charge, en mesure de prendre 328 survivantes de viol et qui ont bénéficié de charges psychosociales. 178 victimes ont porté plainte, 546 survivantes de VBG et 183 groupements féminins de plus de 10 000 membres ont reçu des financements de leur projet d'activité sociale. Bien qu'ils ne soient pas destinés de façon spécifique aux femmes infertiles, ces mécanismes permettent de prendre en charge les femmes exposées au risque d'infertilité en raison des violences subies. De ce point de vue, l'initiative de Merck est à saluer et à encourager pour le partage d'expériences et pour une meilleure prise en charge de l'infertilité en Afrique, en espérant voir bientôt en Côte d'Ivoire. Je vous remercie.
Thank you very much, Rachel, for that question. First of all, let me say it's true. In Tanzania, we didn't know anything about this, and surely it's an eye-opener for us. And when I got your invitation and see talking about infertility, I was saying, wow, I have to go and see what's going on. Tanzania, like other African countries, we have the same culture. Almost same level of development, and for sure what I can say in Tanzania, we have this problem of infertility because we are not unmarried. We have the problem of fertility, although I don't have statistical data, but I know there are many women who are suffering, the same as what we saw from the video, and that woman was talking Swahili, which is also my language. And for those who didn't understand, the first clip actually that woman was so much disconnected from the husband. She had stigma, and she ended up with diabetes and depression. So that is what you can get when you don't have a child. So what I can say in Tanzania, as another say, you have a problem, and I know there are also myths. When you don't get a child, you don't go to heaven. When you die, that is the thing that is going on, because the Bible said that God sent people to have children. So say, go and fill the world. So if you don't get children, it means you don't go to heaven. So this is the myth. It's some sort of ignorance, but I think as parliamentarians, we have really to be an agent of change. And I can assure you, panelists, when I go home, first of all sensitize my fellow parliamentarians, especially men, because as we hear, about 50% men are infected, but they don't want to say that they are dead. And even the culture is like that. And you know that men who are infertile, they will go on rampage and have other women. And for sure, if the woman know that this man is also infertile, she will also go to other men and claim that that baby is for this problem, and we end up having street children, we end up having broken marriages, and so on and so forth. Since this is the first time, and I've already said, actually I congratulate the Merck for breaking the silence, and I would like, or I would rather love to see you in Tanzania launching the same campaign, so that we join your campaign. Thank you very much. Welcome.